నమస్కారం జీవన రేఖ కార్యక్రమానికి స్వాగతం. కార్డియాక్ అరెస్ట్ అంటే ఏంటి, దాని సిమ్టమ్స్ ఎలా ఉంటాయి, సడన్ హార్ట్ అటాక్ ఎందుకు వస్తుంది, ఏ వయసు వారికి వస్తుంది, ఆకస్మిక కార్డియాక్ అరెస్ట్ ను నివారించొచ్చా, తీసుకోవాల్సిన జాగ్రత్తలేంటి, అమోర్ హాస్పిటల్స్ నుంచి కన్సల్టెంట్ ఇంటర్వెన్షనల్ కార్డియాలజిస్ట్ డాక్టర్ ఇమ్రాన్ ఉల్ హక్ గారు మనతో పాటు ఉన్నారు. వారిని అడిగి డీటెయిల్ గా తెలుసుకుందాం. అలాగే మీకు కూడా ఎలాంటి సందేహాలున్నా స్క్రీన్ మీద కనిపిస్తున్న నంబర్స్ కి కాల్ చేసి డాక్టర్ గారితో మాట్లాడొచ్చు. నమస్తే డాక్టర్. సో కార్డియాక్ అరెస్ట్ అనేది ఎప్పటి నుంచో ఉన్నా కూడా ఈ ఆఫ్టర్ కరోనా తర్వాత ఎక్కువగా వినిపిస్తుంది. కార్డియాక్ అరెస్ట్ అంటే ఏంటి అసలు?
See, there are two different terminologies. One is cardiac arrest, another is sudden cardiac death. Cardiac arrest, what do you mean by sudden cardiac arrest is a cessation of heart activity, which leads to hemodynamic collapse. A person's heart suddenly stops beating and his vitals completely are gone, like there is no pulse, no blood pressure. That is called as cardiac arrest. Whereas what is sudden cardiac death ante, a person who was normal, within 1 hour of symptom onset he dies.
Okay.
So that is called as sudden cardiac death. So sudden cardiac arrest is reversible with appropriate measures. Like we see a person who has sudden cardiac arrest, there can be chances that he can revive with appropriate measures.
Okay.
So this is the difference between a cardiac arrest and a cardiac death.
ఓకే. ఇప్పుడు మీరు అన్నారు కదా కార్డియాక్ అరెస్ట్, సడన్ కార్డియాక్ అరెస్ట్ అని చెప్పి, చాలా మందిలో కొంతమందిలో వార్నింగ్స్ వస్తూ ఉంటాయి, ఒక్కసారి 2 సార్లు, కొంతమందికి స్టన్స్ వేస్తూ ఉంటారు, కొంతమంది అసలు ఎలాంటి సిమ్టమ్స్ లేకుండా చిన్న వయసులో, చాలా చిన్న ఏజ్ లో బిట్వీన్ 20 to 40 మధ్యలోనే సడన్ గా చనిపోతుంటారు. అసలు ఎలాంటి హెల్త్ ఇష్యూస్ ఉండవు వాళ్ళకి. దీన్ని ఎలా చూడొచ్చు అసలు?
See, to understand these different things, you should know what are the causes of sudden cardiac arrest. Okay. To understand the causes, you should know how our heart functions. So basically, heart is one of the most important organ in the body. It has got 4 walls, you can say, 4 walls, 4 chambers. Okay. It has got its own blood supply, which are called as coronary arteries. Okay. And it has got its own covering, which is called as pericardium. So any disease which affect these structures of the heart will lead to sudden cardiac arrest. So these diseases vary depending on different ages. So if a young person experience sudden cardiac arrest, usually it will be disease which affect the heart muscle or a disease which affect the conduction system. Heart also has got a conduction system. Conduction system ante it has got its own electrical supply, so which maintains the heart rate in the range of 60 to 100 beats per minute. So any disease which affects this conduction system will likely cause sudden cardiac arrest. The heart rate can go beyond 100 or it can go less than 60. Beyond 100, sometimes 200, 300 kuda heart rate will go down. So in that case, that is called as VT or VF. These persons are prone for sudden cardiac arrest. Okay. Sometimes heart rate can go below 30 also. These people also are prone for sudden cardiac arrest. So all these diseases, and if you take middle age, if those blood vessels are affected in middle age, that is called atherosclerosis, which we commonly see as heart attack. Okay. Usually heart attacks are common in middle age and they gradually increase as age advances. So a person experiencing sudden cardiac arrest from middle age to elderly, likely the cause will be a coronary artery disease or heart attack.
Okay.
A young person experiencing sudden cardiac arrest is likely because of diseases which affect the heart muscle itself or a disease which is affecting the conduction system. There are some genetic disease also which affects the heart. So in those cases also a cardiac arrest occurs at an earlier age.
Okay.
So depending on the cause, there is like all age groups which are affected relatively.
ఓకే. ఇప్పుడు చాలా మందికి కొలెస్ట్రాల్ ఎక్కువ ఉంటే కూడా, బార్డర్ లో ఉన్నా లేకపోతే కొంచెం ఎక్కువగా ఉన్నా, ఈ కొలెస్ట్రాల్ వల్ల కూడా కార్డియాక్ అరెస్ట్ జరుగుతుంది అని అంటుంటారు. ఇది నిజమేనా?
See, the most common reason for cardiac arrest is a heart disease, that is coronary heart disease or heart attacks. So heart attacks, you have many causes which can cause blockages in the blood vessels in the heart. So among those include your diabetes, hypertension and cholesterol. So all these, if it is not controlled, they deposit or plaques, that is called as plaques, inside the heart. So high cholesterol will deposit in the blood vessels in the heart, that can lead to heart attack. So basically any disease, any risk factor, if not controlled, will ultimately lead to a coronary artery disease and that can cause sudden cardiac arrest in these people.
ఓకే. ఇప్పుడు చాలా మందికి వార్నింగ్ సైన్స్ వస్తూ ఉంటాయి. హార్ట్ అటాక్ వచ్చే ముందు చాలా మందికి స్వెట్ రావడము, లేకపోతే లెఫ్ట్ హ్యాండ్ మొత్తం పెయిన్ రావడము, ఇవన్నీ ఎంత టైం లోపల హాస్పిటల్ కి తీసుకెళ్తే సేవ్ అవుతారు వాళ్ళు?
Yes. See, if you are in a susceptible age group, like you are 30 and you are suspecting that coronary artery disease is the possibility, so you will experience some symptoms. usually 1 to 2 days before you develop a major heart attack, you will be having some type of chest pain, chest discomfort. It will get relieved within 15 minutes, 30 minutes. You will have chest pain which is radiating to back, which will be associated with sweating, hand pain. All these symptoms you can experience. And most importantly, whenever you try to walk, your chest pain increases. That is called as exertional angina. Okay, these are the warning symptoms before a major heart attack. So these will be there usually most of these patients 2 to 3 days before they develop in frank chest pain, where they develop severe chest pain when which is not controllable. So any person in the susceptible age group, if they experience these kind of symptoms, then they have to seek immediate medical attention. Most of these people, they tend to avoid this crucial time, and they just sit at home without investigation, and these are the people who die before even reaching the hospital.
Okay.
There are some other symptoms also. This is related to coronary artery disease. Suppose in young people are there, they experience some other symptoms. See, they may not be having blockages, but if they have these diseases which affect the heart muscle, these are called as cardiomyopathies. Dilated cardiomyopathy, hypertrophic cardiomyopathy, these are quite common in this young age group between 20 to 30 years. Or some congenital heart disease which are not corrected. You see some people having holes in the heart from the birth. So if these are not treated in the early age group, these people, they experience some unusual symptoms before the arrest, like they will have some palpitations, dadadadamari. So these are palpitations. They experience some giddiness or near syncope. Some people with these diseases, they have history of syncope before going for arrest. Like maybe 1 month, 2 months before, they'll experience a syncope and they'll just fall down, and they'll think that it is not significant. But these patients, when they have syncope, that becomes highly significant. That is a warning that they may go in for arrest. So identifying these symptoms before landing up in frank arrest is very crucial.
Okay. ఇప్పుడు చాలా మంది మార్నింగ్ టైమ్స్లో ఎక్కువగా సైక్లింగ్, జాగింగ్ అలాంటివి చేస్తూ ఉంటారు. అలాంటివి చేసే టైంలో కూడా కొంతమందికి చిన్న పెయిన్ లాగా అనిపిస్తూ ఉంటుంది, మళ్ళీ వెళ్ళిపోతుంది. అది ఇది దేనికి రిలేటెడ్? అది
this is the very important warning symptom which has not to be ignored. See, any pain which increases on exertion ante you are running, you are walking, or you are doing cycling, you are climbing stairs, in that time you are having some chest pain or chest heaviness, that is very classical of heart disease. Okay. So whenever you are experiencing such symptoms, you have to seek immediate medical attention and undergo appropriate investigations. If you leave these symptoms, they will be there for few days. After maybe about 15 days or 1 month, you will end up in frank heart attack. Okay, these are warning symptoms before developing a major heart attack. So any such symptoms should not be ignored and immediate medical attention has to be taken.
Okay, ఇప్పుడు చాలా మందికి చెస్ట్ పెయిన్ అనేది గ్యాస్ట్రిక్ ప్రాబ్లం వల్ల కూడా వస్తూ ఉంటుంది కదా. సో ఇది టెస్ట్ వల్ల తెలుసుకుంటారా, లేకపోతే గ్యాస్ట్రిక్ తగ్గిపోతే అది తగ్గిపోతుందా?
No, see, at this point in life, we are seeing even heart attacks occurring in young people. So there is no age group which is totally away from heart attack. So even in young persons, if they are experiencing any chest pain, don't ignore saying that it is gastric pain. Okay, any chest pain which is not getting relieved, especially you take some measures for acidity, some drugs you have taken for acidity, even then your chest pain is not getting relieved, or your chest pain is severe or is associated with sweating, and you come under risk category, you have risk factors, you have diabetes, you have hypertension, don't think that it is acidity pain. Okay, just go to the hospital, get an ECG done, get appropriate testing done. Only when the doctor rules out that there is no cardiac symptoms or it is unlikely to be cardiac, only then you can sit at home. So any chest pain, even if it is acidity, just seek medical attention if it is not getting relieved.
ఓకే. ఇప్పుడు ఈ టెస్ట్ల విషయానికి వస్తే ఈసీజీ ఒకటి, థ్రెడ్మిల్ టెస్ట్ అని చెప్పి, ఇవి బేసిక్ టెస్ట్లా లేకపోతే ఎవరికి చేస్తారు ఇవి?
These are the basic tests which we do. Any person who comes to us with chest pain, the basic investigation we advise is ECG. So ECG will detect heart attacks. Okay, the most common question which I commonly encounter in our practice is, suppose if ECG 2D echo are normal, does it mean that our heart is normal? The answer is no. Okay, a person can have critical blockages in all the 3 vessels. In spite of that, ECG 2D echo can be entirely normal. So there are other tests to detect these blockages. Okay, there is a non-invasive test. If a person can walk or he can do a treadmill, get a treadmill test. Okay, a positive treadmill indicates that blockages are likely. Okay, suppose a person is elderly, he is not able to walk, and still we are suspecting that he can have a heart disease or heart block, then he has to undergo a coronary angiogram. So coronary angiogram is the only definitive confirmatory test to detect blockages in the heart. So a normal ECG, many times you have seen a person comes to our hospital with chest pain, we do ECG, 2D echo are normal, then he says there is no cardiac problem, he just tries to leave. That is when he should listen to a doctor, and when a doctor advises that he needs further testing, he has to undergo those testings.
సో నార్మల్ పర్సన్కి అయితే ఈసీజీలో ఓకే నార్మల్గా ఉంటుంది, లేదు ఇంకొంచెం డెప్త్గా చేయాలి అంటే దాని తర్వాత టెస్ట్లు చేయాలి. ఓకే ఓకే. ఇప్పుడు చాలామంది తినే ఫుడ్లో కూడా బయట పిజ్జాస్ ఇవన్నీ తీసుకుంటారు కదా, ఇవి తీసుకోవడం వల్ల కూడా కొంచెం బ్లాకేజెస్ వస్తాయి, కొలెస్ట్రాల్ పెరిగి అని అంటుంటారు. సో ఫుడ్ విషయంలో ఎలా ఉంటుంది?
See, a strict diet is very much important in controlling these risk factors. You consume a diet which is high in saturated fats, red meat, be it all these burgers, pizzas, all street foods, they are very high in saturated fats. Any saturated fat excess will get deposited in your blood vessels, and it can also lead to many other problems. See, these foods are loaded with calories, so you tend to get obese. When you get obese, you have all sort of cycle going on, which is called as metabolic syndrome. You get diabetes, you get hypertension, you get insulin resistance. Again, this in turn will increase your coronary atherosclerosis. So a good diet is very very important in preventing these episodes of heart attack and sudden cardiac arrest.
ఓకే ఓకే. ఇప్పుడు చాలా మందికి హార్ట్ అటాక్స్ కానీ కార్డియాక్ అరెస్ట్లు కానీ ఎర్లీ మార్నింగ్ 3-4 ఆ టైంలో వస్తుంటాయి. ఎందుకు పర్టికులర్ అదే టైంలో ఎందుకు వస్తుంటాయి?
See, early morning is the time when our hormones are at the peak level. We have some hormones called as catecholamines. So they undergo a circadian rhythm, that is their secretion increases in the early morning, decreases late evening. So based on these hormones which are excess in the morning, these people are prone for heart attacks and cardiac arrest in the morning time, particularly 3 a.m. to 12 p.m. you can say. So this is a time when these hormones are at their peak, and also cardiac arrest and cardiac events or other cardiovascular events like a stroke also occur very commonly because of these excessive catecholamines.
ఓకే ఓకే ఓకే. సో ఇప్పుడు మీ దగ్గరకు వచ్చిన పేషెంట్స్కి ఈ టెస్ట్లన్నీ చేసిన తర్వాత కొంచెం వార్నింగ్స్ తెలుస్తున్నాయి, కార్డియాక్ అరెస్ట్ వస్తుంది అని చెప్పేసి వాళ్ళకి అసలు ఎలాంటి ట్రీట్మెంట్స్ ఇస్తారు?
See, when a person comes with chest pain, we get an ECG, 2D echo. Suppose if it is abnormal, ECG shows evidence of that there can be blockages. So next investigation we advise is a direct coronary angiogram. Okay. In angiogram we can make out if there are blockages and what has to be done for the blockages. If there are 1 or 2 blocks, we can put a stent and the patient recovers. If there are many blockages which cannot be corrected, if the person is a diabetes, he cannot be stented, then the person will likely go for bypass surgery.
Okay.
So this is in patients with heart attacks. Okay. There are patients who comes with heart failure. Okay, those patients usually require heart failure medicines. Once they are stabilized, they are prone for sudden cardiac arrest in the form of they get abnormal rhythm called as ventricular tachycardia. So to control these rhythms and to prevent further episodes of heart attack, like if they are going for arrest repeatedly, then we place a device called as ICD.
Okay.
ICD is a device which is placed in your body that detects this abnormal heart rhythm and it corrects automatically. So this is patients for heart failure. Okay.
Oh, heart failure.
Heart failure who have episodes of like who has evidence of cardiac arrest in the past and who have revived. In these patients prophylactically we place this ICD device.
ICD device.
ICD device.
Okay.
Okay. That is one thing. In patients in whom we have found that there is a congenital heart disease, that they have some uncorrected holes or some other disease, that those patients has to undergo surgery. Okay. Some people will be having muscle disorders of the heart. Even these people are prone for sudden cardiac arrest. So these people also sometimes will need ICD device to prevent sudden cardiac arrest.
Okay.
So only when the person comes after appropriate investigations, we will come to know what type of treatment he needs so as to prevent these episodes of sudden cardiac arrest.
ఓకే ఓకే. ఇప్పుడు స్టంట్ కి ఐసిడి ప్రొఫైల్ డివైస్ కి ఏంటి తేడా, డిఫరెన్స్ ఏంటి?
See, stent is a device which is used to treat blockages in the heart. Suppose if your heart vessels are blocked, then we put a stent. ICD is like a pacemaker. It is outside the heart. It is kept outside the heart and it detects abnormal rhythm. Like as I told, there are episodes called as ventricular tachycardia, ventricular fibrillation, where the heart rate goes to 200-300 times. If these episodes are not treated within 30 seconds or 1 minute, the patient collapses. So these episodes has to be immediately treated with a shock.
Okay.
So ICD is a device which detects these episodes and it gives shock to these people. So it is like a life-saving device in certain risk category of patients.
ఓకే ఓకే. సో ఇప్పుడు చాలా మందికి ఒకవేళ చెస్ట్ లో పెయిన్ ఉంది, హార్ట్ అటాక్ వచ్చే సిమ్టమ్స్ ఉన్నాయి అని అనిపిస్తే ఎక్కువగా దగ్గమని చెప్తుంటారు, కాఫ్ చేయమని చెప్తూ ఉంటారు. ఇది ఎంతవరకు నిజం?
No, these are only temporary measures. So these are not the permanent cures. So a person with chest pain and heart attack should not keep coughing at the home and just remain there. This is temporary measures. You just go to the hospital and get treatment done.
ఓకే, ఇప్పుడు మీరు చెప్పిన ఈ స్టంట్ ఐసీడీ డివైస్ కాకుండా హార్ట్ ట్రాన్స్ప్లాంటేషన్ చేస్తూ ఉంటారు, ఎవరికి చేస్తారా అది?
See, heart transplantation is usually in persons whose heart pumping is severely down and it cannot be corrected no matter what. Okay, in these people heart transplantation is advisable, but there is a long list of patients and long list of criteria you have to fulfill for heart transplantation. So heart transplantation we can say is the last resort, not usually preferred. Before that there are a lot of other devices also. In some patients with heart failure there is another device called as CRT, okay, cardiac resynchronization therapy. What they do is, if the heart pumping is down, it is a device which is similar to pacemaker, they insert in the heart and that will increase your heart pumping. So these are all medical and the measures which we can try before directly sending the patients for heart transplantation.
ఓకే ఓకే. సో ఇప్పుడు ఐసీడీ డివైస్ ని సెట్ చేసిన తర్వాత అది ఇంకా లైఫ్ లాంగ్ ఉండాలా, లేకపోతే రెగ్యులర్ చెకప్స్ కి రావాలా, ఎలా అది సెట్ అయిపోతుందా బాడీకి?
No, once an ICD is implanted, you need to undergo regular checkups. Okay, every yearly the ICD has to be tested. They do test from outside the body only. They detect what is the abnormal rhythm, any ICD has given any shocks or those things. ICD also will have its battery. Usually 10 to 15 years the battery lasts. So once that battery is depleted, you have to replace the battery. So once you underwent an ICD implantation, usually lifelong you have to be on periodic checkups.
ఓకే
So that is a must. Yes.
ఓకే, కమింగ్ టు ఫుడ్, ఒకసారి సర్జరీ చేసిన తర్వాత లేకపోతే స్టంటో ఈ డివైస్ సెట్ చేసిన తర్వాత వాళ్ళు ఎలాంటి ఫుడ్ తీసుకోవాలి?
See, the diet plays a very important role in preventing. Okay, once you have got a heart attack, then that comes secondary prevention. This is called secondary prevention. So most of this is a time when our patients listen to us. Before the heart attack, in spite of saying, patients don't listen, they just consume all these diets. But once they develop a heart attack, this is a time when they are more aware to our advice. So in these patients usually we advise to have a healthy diet, a diet which is rich in fruits, vegetables, nuts, avoiding saturated fats, okay, cutting red meat, engaging in regular physical activity. All sorts of healthy diet is advisable in these patients to prevent further episodes of heart attack. It is not that once you put a stent it's over, it lasts lifelong. It is not like that. See, a naturally given blood vessel is getting blocked, we have put a stent, even stent can get a block. Okay, once you put a stent, it is not like lifelong that stent will remain in place. It is bound to get blocked and you have to prevent those blockages.
Okay,
so this includes your regular diet, regular medicines, controlling your risk factors, controlling your diabetes, hypertension. If you have smoking, quit smoking, reduce your consumption of alcohol, regular physical activity. By doing these things, your stent getting blocked chances will reduce.
ఓకే ఓకే. కమింగ్ టు ఎక్సర్సైజెస్, ఎలాంటి ఎక్సర్సైజెస్ చెప్తారు వాళ్ళకి?
See, we don't ask patients to go to gym and do heavy weights after putting a stent. That is usually not advisable. Recommended activity is like a 30 to 40 minutes of moderate intensity activity, like brisk walking for at least 40 minutes a day, maybe 3 to 5 days in a week. That should be sufficient for a person. Okay, he need not engage himself in heavy physical exertion, which has to be avoided. Immediately after stenting, so we avoid lifting heavy weights and other things. Only when the person has recovered from stenting and his heart pumping also has improved, then we advise moderate intensity activity, either in the form of regular brisk walking or some cycling, which he can continue.
ఓకే ఓకే. ఇప్పుడు సడన్ గా కార్డియాక్ అరెస్ట్ అయిన తర్వాత ఇంటి నుంచి హాస్పిటల్కి వచ్చేలోపు ఫస్ట్ ఎయిడ్ చేయాలి అంటే చాలా మంది ఇప్పుడు సిపిఆర్ చాలా మందికి తెలుసు చేస్తున్నారు. సో సిపిఆర్ చేస్తే సరిపోతుందా, లేకపోతే ఇంకేమైనా చేయాలా సడన్ గా?
See, when you are experiencing chest pain, there is no point in doing CPR if the person is conscious. Only unconscious is there, and you are definitely a CPR will be helpful. Okay, a trained person doing CPR will improve his chances of survival. So the main aim in doing CPR is to preserve the blood supply to the brain. So when you start doing CPR, you are doing a mechanical pump. You are pumping the blood from the heart by mechanical means. So that will prevent damage to the brain. By the time you reach hospital, you can undergo appropriate investigations and measures. So a bystander CPR or a defibrillation, if given immediately when the patient goes for arrest, those chances of survival are more better than person who doesn't receive CPR.
Okay.
Suppose a 5-10 minutes gap is there between the person having cardiac arrest and reaching hospital, his brain will undergo irreversible damage. That is called as hypoxic injury. So even if the person is revived, he will not be totally normal after that. If someone has given a CPR and while giving CPR he has reached hospital, then his chances of recovery are more. So a bystander CPR definitely is recommended if a person experiences cardiac arrest.
ఓకే ఈ జెనెటికల్ ప్రాబ్లమ్స్ ఉన్న వాళ్ళు పిల్లలకు వస్తుంది అని అనుకున్నప్పుడు ఎలాంటి ప్రివెన్షన్స్ తీసుకోవాలి?
See, if you have a genetic problem, you will have some risk factors along with that, like your family member. If there is history of sudden death in one of your family members, less than 40 years, any person in your family has died, then you may be having some genetic problem.
Okay.
In those persons, appropriate screening has to be done. Screening in the sense there can be excessive of cholesterol, familial hypertriglyceridemia. So get those testing done for cholesterol levels. Then all disorders of the heart muscle are possible in such people, or disorders of rhythms are possible. So any person with a family member dying before 40 years because of cardiac origin should undergo appropriate testing in the hospital in the form of ECG, 2D echo, blood investigations, and if possible exercise testing or even electrophysiological testings. And also in some cases genetic testing. Some diseases which can be detected only by genetic testing, he has to undergo those tests.
ఓకే సో ఇప్పుడు చాలా మందిలో ఉన్న మైండ్లో జరుగుతున్నది ఏంటంటే ఆఫ్టర్ కరోనా టైంలో వాడిన మెడిసిన్స్, వ్యాక్సిన్స్, వీటి వల్ల ఇప్పుడు ఈ హార్ట్ అటాక్స్ అనేవి ఎక్కువ వస్తున్నాయి చిన్న ఏజ్లో అని చెప్పేసి, ఇది నిజమేనా మిథ్యా?
No, this is not entirely true actually. See, there is one of the rare complication of corona vaccine that it causes thrombocytopenia, that is the platelet count goes down and that can cause blood clots, but that is very rare and that is seen in persons like immediately after few days of vaccination. But the benefit it has given is far exceeds those complications. So a person who says that he has taken corona vaccine maybe 2 years back, now he is having some problem, there is no relation between these things. There are some other risk factors which are causing the problem right now. If at all that problem had happened, it was just in immediate post vaccination period, and that is very rare.
ఓకే మరి చిన్న కిడ్స్లో కూడా ఈ మధ్య 5th 10th క్లాస్ స్టూడెంట్స్ వీళ్ళలో కూడా కార్డియాక్ అరెస్ట్ అనేది చూస్తున్నాం. దీనికి రీజన్ ఏంటి? ఇది జెనెటికల్ లేకపోతే ఇంకేదైనా రీజన్ ఉందా?
See, these people, most of these people, as I already told, they have some type of heart disease through birth itself. Either they will be having a hole which is not corrected, or they will be having some genetic problem where these genetic problems like these are called as QT syndrome, long QT, short QT syndrome, or VTVF, idiopathic things. So these children will be having some underlying diseases which usually will not be detected. And when these children they do some exertion, they have these type of arrhythmias and they experience sudden cardiac arrest. So as I told you, if there is a family history of these diseases, always it is better to screen even children to rule out these diseases.
ఇప్పుడు షుగరు, బీపీ, థైరాయిడ్ ఇవి ఉన్నప్పుడు ఆటోమేటిక్గా హార్ట్ అటాక్స్ అనేవి కామన్గా వస్తుంటాయని చెప్తూ ఉంటారు. వీళ్ళు ఎలాంటి ప్రివెన్షన్స్ తీసుకోవచ్చు?
See, the most common risk factor for heart attack is your uncontrolled sugars. See, problem with sugar is usually when sugar is very high, most of these patients will be asymptomatic. They will think that it is just increased sugar, we are fine, no much problem. That is the common attitude which we see among patients. But uncontrolled sugar over a long period of time will damage your organs. The aim in a diabetic patient is to control the sugars. If your sugars are beyond the recommended range over a period of few years, 5 years, 10 years down the line, you will develop very severe blockages in your heart vessels, and that will be very severe. So the most severe disease which we see on angiogram is patients with diabetes. When a person is detected as having diabetes, he should undergo regular testing, and it has to be strictly controlled. A person whose diabetes is strictly controlled is unlikely to have this problem over 10 years afterwards. But if it is not controlled, maybe in 5 years only he will develop severe heart attacks. So controlling your risk factors like diabetes, similar is the case with hypertension or cholesterol. All these factors, if controlled, they definitely prevent your atherosclerosis and reduce the risk of heart attacks.
ఓకే, సో ఇప్పుడు ఎలాంటి ప్రాబ్లమ్స్ లేవు, నార్మల్ లైఫ్ లీడ్ చేస్తున్న వాళ్ళు కూడా ఎక్కువగా స్ట్రెస్ ఎక్కువ ఉండడం వల్ల లేకపోతే పొల్యూషన్ ఎక్కువగా ఉండడం వల్ల కూడా అప్పుడప్పుడు బ్లాకేజెస్ వస్తూ ఉంటాయని చెప్తుంటారు, ఇది నిజమేనా?
Yes, see, we have seen many people who don't have any risk factors. There is no diabetes, no hypertension, they are non-smoker, but even then they experience heart attack. So this is stress. Okay, we are living in a world where stress has become a part of our daily life.
Yes.
So increased stress, altered sleeping pattern, altered dietary changes, even without risk factors, these persons are prone for heart attack. Okay? So modifying stress, engaging in healthy activities is very important to prevent these heart attacks.
ఓకే ఓకే, ఎక్కువగా మేల్లో ఎక్కువ వస్తుందా, ఫీమేల్స్లో ఎక్కువ వస్తుందా?
Yeah, heart attacks is very common in males up to a certain age group. Like up to menopause, in females, the incidence of heart attacks is more in males. Once females attain menopause, the risk is almost same. Okay. So any female after 50 years, the risk will be same as males. Okay, but below 50 years, males are very likely to develop heart attack. This is basically because of the excess stress, excess risk factors, smoking, other things which are quite prevalent in males than females.
ఓకే ఓకే, అండ్ ఫైనల్గా హార్ట్ అటాక్స్ రాకుండా ఉండాలి అంటే ఎలాంటి ఫుడ్ని తీసుకుంటూ ఉండాలి కంటిన్యూస్గా?
See, we always stress on a healthy diet. Okay, a diet which is rich in balanced diet, which is rich in fruits, vegetables, nuts, avoiding red meat, avoiding junk food, engaging in regular physical activity, consuming a lot of fruits, non-dairy products. All these things are encouraged so as to prevent the risk of developing heart attacks.
Okay.
So along with your regular screening, you have to undergo regular screening. Once you cross a 30-35 years age, you have to undergo yearly screening to detect your diabetes, hypertension. Along with that, you have to maintain a good diet. Along with that, you have to undergo regular physical activity.
Okay.
With all these measures, your risk of developing heart attacks is dramatically reduced.
ఓకే 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 డాక్టర్, థ్యాంక్ యూ సో మచ్.
Thank you.
చూసారు కదండి, ఇది ఇవాల్టి జీవన రేఖ కార్యక్రమం. నమస్తే.